My name's Carmen. I am the adult peer support worker here at Carers NT. I run groups, and it's carers coming together that are looking after people with a mental illness. It's not telling anyone what to do, but it's us coming together and having an informal lunch and coming up with strategies and having the conversations, and there's no pressure. It's all confidential.
My name's Noelene. I'm the mental health coordinator at Carers NT in the mental health program, and we're looking at providing care and support as well as education, information, and making sure they're connected to appropriate services and accessing as much support as they need to fulfil their caring role. So a carer is someone who provides unpaid care and support to a family member or friend who might experience chronic illness, disability, mental illness, drug and alcohol addiction, gambling addiction. They could be frail aged, have cancer, or our registered carers range in age anywhere upward from 5 years old.
I'm also a carer, so I have been a carer for many, many years, and it just happened that the role that I had previously was completely different, and I decided, because of what I was doing in my caring role, the experience that I'd gained now brought me into mental health, and so that was my reason for moving over.
My qualifications are as a mechanical engineer, and I've worked as an academic in industrial settings and in offices. But from my early adulthood, I've also been a carer for a person with a mental illness, and in those years did a lot of volunteer work. So I've had sort of this long-term interest and I guess connection with mental health through volunteering, and then I had a small break from work, and at the time I was looking to re-enter the workforce, so I was applying for engineering jobs and also jobs in this field because I'd considered many times about going into the area, and it just so happened that those life experiences and some of the qualifications I gained as a volunteer along the way translated very well into this role, and also the skills I've developed working in project management, also transferable.
It's allowed me to open up conversations. I mean, you have to be really careful about what you allow yourself to say, but people identify. That's one of the skills that I think I bring to this role.
Yeah, so Carmen and Noelene have completely different skill sets, and it's really satisfying to see them work together and complementing each other in the different work that they're doing and how they collaborate to get everything up and running at the same time.
I mean, coming here to Carers, I'm fortunate enough that I work with people, and especially Noelene. The skills that she brings, she's fantastic. So we sort of, the both of us.
So Carmen's got really good people skills and I've got some fairly good technical skills, and we very much learn off each other in the development of our program. So we come with different skills, but I think we have that similar background, which is the same background that connects us with the people we're caring for, and that's why it's easy to connect and build on those strengths. I've had conversations with people about my career change, and they've had the view of, I couldn't change. And my advice to them is, well, those former qualifications don't disappear. And if you make the change and you're not happy with it, you can revert. Having said that, I believe that when you're working in an area that you're passionate about, it's not really work. And so all those things that ground you down about your previous job and your previous career, and you start investing yourself in an area you're't about, then it's easy to let go. It's more emotional baggage than any barrier in practicality.
Volunteering is a great way to come on board and assist carers, but also for yourself, if you're thinking about working in this industry, it's a great way to test the waters by coming on board as a volunteer.